Hi guys, I don't know why the video quality seems worse than normal today. I don't know why. But anyway, here we are. Here I am. I made it. September's not over. I made it. So this topic, this subject, was one of my earliest ideas for a video when I was trying to decide what to do after I finished my biographical videos. And I shelved it because it seemed too specific. It seemed like if you don't live where I live, it's not going to apply to you, so why are you going to care? But I'm realizing now that details might be specific to where I live, but the overall concept of people not getting enough support, um, unfortunately applies in a lot of places. Some of the statistics about Toronto homelessness and mental illness can apply to, many big cities in many developed countries. So I decided to go ahead with it and raise some awareness. And I'm doing two videos because it's a lot to talk about, and I feel like it's easier to digest if I divide it up a bit. And the most egregious, worst stuff is going to be in the second video. Um, so let's get started. So my first issue with the system is they seem to think this is sarcasm, but this is what you hear among people who deal with this stuff. They seem to think your disability ends when you turn 18. Could be 19 or 21, depending on the program. I know one program for employment help that has a cutoff of 25, but there's a cutoff, and it's young adults. Once you reach a certain age, you no longer qualify for a huge amount of help. There is substantially less stuff out there once you're an adult. So, with autism specifically, there are entire special schools, clinics, centers for children with autism to receive different types of therapies. Some are privately run. There are government programs. Usually, you would have to get like some money from the government to apply to a program of your choice for your child. But there are different types of facilities. There's, for example, for different autism and other special needs as well, could go to Holland Blue Review Kids Rehab, and that's totally covered by the government. As an adult, nothing. Like these kids have access to social groups, autism specific therapies, other types of therapies depending on the special needs. I know of two places, in my area that serve adults. One is private and very expensive. One is extremely limited what they offer for adults. I went to the social group in that place, and I think there were three or four other people there. And it wasn't for me, unfortunately, various reasons. I should probably try it again in the future, but I wish there were more options out there for me. And in terms of therapy, I believe as a child, I would have benefited from all three speech therapy, occupational therapy, and physical therapy. Now, I'm not surprised I didn't receive those because of my age. If I was like 10 years younger or more, I think my childhood would have looked different and I would have received more services. So that's neither here nor there. The problem is now I'm an adult and I would like those services and I can't access them. Speech therapy, the only way you're getting that covered by the government is through a hospital or a rehab facility. So, say you had a stroke and now you need some speech therapy. That's the only way you're going to get that covered. Otherwise, you're paying out of pocket, which I can't afford. Occupational therapy, I actually was able to get some through fighting with a government agency. They gave me, I think it was 3 or 4 sessions. That's supposed to undo 30 years of sensory issues, apparently. Um, and then physio or physical therapy, that's a little bit different. It used to be covered until I think it was 2002 by the government, and anyone could access it like any other medical thing. Now it's if you're under 18, over 65, or on disability, you can still access it. And what I've been able to access through being on disability was like bargain basement compared to what my mom has received through private insurance. It's bargain basement physio. It's better than nothing, and I probably will be going back again for my knee. But it's frustrating because I need so much more help with my body, you know, with exercise and improving my posture, and I need this help, and I can't really access it because I don't have insurance, I'm not, independently wealthy. Um, and I could access all those kinds of therapies much more freely if I was under 18. Apparently, all my issues went away when I turned 18. Like, there's little to no support. The exception, which I'll discuss more in the second video, is intellectual disability, low IQ. There's more support for that group of individuals, which I'll get to in the second video. But all the other myriad special needs that exist out there, they stop supporting you mostly when you hit a certain age. And it's not perfect. There are issues even with the system for children. I know of stories in particular, and the elderly as well, actually, because they're more likely to have medical needs. So there are issues with people not being able to afford medical equipment that's not covered by the government. Wheelchairs, walkers. I know it can be hard, even diapers, special feeding equipment, formulas. A lot of those things that you may not be able to get covered by the government, and it can cause people financial problems. Which leads me into my second problem with the system, which is that we have sort of a two-tier healthcare system in Ontario, in particular when it comes to mental health, more than any other area. So I have to say here, before I continue, I would not give up in a million years the universal healthcare that I have. The stories I've heard out of the States, I've left me with my jaw on the floor, and I've heard nothing comparable in Canada. So because I have complaints, because I say it's not perfect, doesn't mean that it's not good. Doesn't mean we should get rid of it. Doesn't mean I want American style. I have to make that clear. Um, right. So when it comes to this, two-tier system, back when they cut physiotherapy out of being covered by the provincial government, they removed eye doctors and chiropractors as well. So if you want to access those, that's coming out of pocket or private insurance. They never covered the cost of eyeglasses, but the eye doctor appointment used to be covered, and now that's no longer covered. Canada is the only country that has universal health care and not universal pharmacare. So there's issues with people. There's what happens a lot. There are programs, to help people with these various expenses I've just gone over. Not chiropractic per se. That tends to be seen as a luxury, like massage. But some of those other things often tend to be based on income. So prescription drug coverage, getting help with medical equipment. If you're really, really poor, you can get help. But a lot of people are not poor enough to qualify, but don't have, hundreds or thousands of dollars lying around either. So you end up with a lot of people falling through these gaps. Dental is another one. There is no any sort of universal dental coverage. I get help with some of these things from my disability benefit, which I'll discuss in the next video. But yeah, that's also an issue. The biggest gap in the system, though, as far as I'm concerned, where it really, really feels two-tier, is mental health. So just to clarify, a psychiatrist is an MD, a medical doctor. They are covered by the government like any other medical doctor. They diagnose and prescribe. But like any other medical doctor, they don't have tons of time for each patient. They do not administer therapy at all. You go in, here's your problem, and they try to help you like any other type of doctor. Psychologists who are PhDs are not covered by Ontario or any other provincial healthcare system. And they can provide services. They can also diagnose, and they can do longer assessments and different types of testing and that kind of thing that a psychiatrist doesn't have time for. I would love a proper psychological assessment. I've never had one. I've never had any sort of testing before receiving any of my diagnoses. I started looking into it recently. We're talking a minimum of $1,000. There might be one place, a big psychiatric hospital downtown, where I can get one covered if I qualify, but that's a big if. Psychological services are not covered, and that's a big problem. Now, they're not the only ones that can provide therapy. Um, you can also get therapy from like social workers. Sorry, I forgot word social worker for a minute there. People who have a minimum of a master's degree in social work can do therapy and counseling in Ontario as well. I'm communicating with a counselor right now who's a social worker, and we're doing it over the phone because of the plague. Counseling, no, implies short term. There's a time limit. Therapy can go on as long as you want. So, counseling services, such as the social worker I'm currently seeing, you can find covered by the government, although they're few and far between. The wait lists tend to be as long as your arm, but they exist. If you want longer, more in depth therapy, psychological services, you cannot get that covered. And even on my disability benefit, where you would think we would represent, the part of the population that needs that help the most, we can't get that covered. People are losing out. I think if people had better access to therapy, there might be less antidepressant prescriptions. I'll do a video on psych meds and my opinions on that. The government of Ontario claimed they were going to start covering therapy programs for people with depression and anxiety. I don't know what came of that. The plague hit, so I guess that got pushed to the side. So I'll believe that when I see it with this government. I really will. We have a conservative premier, sort of an American style socialist. The idea of him actually putting money into, capitalist, whoa, big misspeak. The idea of him actually putting money into a program is kind of foreign sounding to me. So we'll see. But if that does happen, that would be great. What I would love to see as well, and this also goes for prescription drugs and medical equipment, hearing aids, eyeglasses. I would like to see the government put a cap on how much can be charged for those things because there's a huge markup, and no one should be profiting, I think, in these huge ways off healthcare products. And I would like that same rule applied to therapists because this industry standard is $200 an hour, which, as far as I'm concerned, no one needs to be making. And if they capped it so they couldn't charge anywhere near that much, that would make it accessible to a lot more people. Better still would be fully covered, but I feel like that might be a halfway measure. Um, that's just my opinion of something I would like to see. One thing you can tend to find covered by the government is group therapy. So I have done a mindfulness group. I was supposed to be doing a cognitive behavioral therapy group, but it got canceled because of the plague. And I'm on the wait list for dialectical behavior therapy. That involves group and one on one. That's literally the only time I've heard one on one, being covered by the government outside of a social worker. Um, I understand why the groups are much cheaper, but they're not even running enough groups. I was on the DBT wait list for over a year. I suspect I would have got in earlier this year, but everything's on hold now. But if you're in crisis now, therapy in a year is not useful. There's nowhere to go. There's no help if you're in crisis now. It's long wait lists for psychiatrists, any sort of government, therapy, funded therapy. If you're independently wealthy, great, you can get therapy tomorrow. Or having private insurance. Even some of the insurance isn't that great with mental health coverage, I've noticed. Um, Other than that, though, you're kind of screwed. And it's really, really unfair. If you break your arm, you can go to Emerge to give you a cast. If I'm having a mental crisis, I can go to Emerge if I want. I'll just sit there for hours waiting to be seen and get sent home. Sometimes you just need to talk to somebody, and I can't go anywhere to just talk to somebody, on an immediate basis. It doesn't work like that. There are crisis lines you can call. I find them hit and miss. One I like better than the other, but they're both volunteers. Both the ones I've used are volunteers. They're not professionally trained. I prefer the professionally trained. The one place in particular, their whole shtick is peer support. So they're trying to tell you that they feel you, they've also experienced this. I don't want to hear that because now I'm worried about you. You know, I just need someone to listen. So I would love that if there was like some sort of walk-in based clinic that you could go to when you need to see someone. But as it is, nothing like that exists. Um, And mental health care overall is just woefully inadequate. So on that cheerful note, I'm going to break and then start the next video. Like I said, I find it more digestible that way. So thank you for watching part 1.